series on a very interesting theme, that is writing post-independence life world, society, cultural materiality, and practices. And today, Professor Joas Nunes is joining us live from England. We appreciate you, Professor Joas, to this lecture series organized by Ravenshaw University, Cuttack, Odisha, India. Professor Nunes is Professor of International Relations, University of York, United Kingdom, and he is also associated with World Health Organization on many important projects on public health and medicine in developing countries, particularly Brazil, Latin American countries, and even he is looking into the global health history and environmental hazards of Caribbean island countries and even Latin America. And he is chiefly known throughout the world as for his pioneering work on functioning of community health centers in Brazil. Today, he's going to deliver a lecture on COVID-19, the health emergencies of neoliberalism, insights for India from the Brazilian experience. I once again welcome you, Professor Nunes, to Ravenshaw University to this lecture series. Thank you.
Thank you.
Thank you, Professor Acharya.
May I also request our Honorable Vice Chancellor to immediately address us?
Namaskar, welcome Joe, and I'm pretty sure this is a very important webinar. Actually, none of us ever saw a pandemic of this kind. Whatever knowledge we have from the history of the Spanish one in 1919. So since then, whatever we are doing in these 4-5 months or 6 months is what we have understood from the books of history or people like Joe and others who have written something on that. So absolutely, there is no doubt that this is a very important one, because every country has got something to learn from another one. Like I very positively think that people may have a lot to learn from Indian food habits, and maybe our there's some noise, and particularly the kind of herbs and the spice that we take all through, and I also work on some of them, and they are all known to have a better immune response in a situation like this. Maybe that is one of the reasons why possibly early numbers were low, and we also have something to give to the world from our herbal medicine or Ayurveda. And if we learn something this time, maybe for times to come, we will be able to use them. But it is actually very important now to exchange notes. Every country should be looking into all other countries, what is happening, how they have been able to control this pandemic, or how they are able to save lives during this terrible time. And above everything, we need to understand what are the precautions being taken by all the people all over the world, and so that we can adopt most of them, if not all, and try to keep the numbers less. We are happy in India that the recovery rate is a little better, and if we go by the huge population we have, they are also possibly, we feel happy about this, that our food habit, our ways of living has perhaps helped a lot in some of the parts of this working against this pandemic. But I cannot say anything like that. Every country has done its best to save their people, and we are also trying. So this is, as I say, the only sentence that can be told about this particular webinar is, we must listen to all countries. every country should listen to all other countries to find out where we are lacking and what is the best practice that the other country has so that we can adopt it into our uh, mode of living. And I always say the pandemic will go, but COVID will remain with us. So this is a time when we have to learn so many hygienic points. I mean, hygiene, personal hygiene, and social living. These two, there is a, I mean, the balancing of both the things will be very much required depending on the kind of culture we have in a particular country, the type of things that we can possibly do, and we should do it. Like in India, we always say namaste, but we have now learned from all other countries to shake hands, to hug each other, or to rub the cheek and all that. We do not used to do. We always used to say namaste, and always used to be have a distance. We were always seen with a different eye because we had set distances from people who will be talking to me at what distance. Socially, this was not accepted, and now COVID has brought us back to that. So we now do it. How close I could be to my family, how close I could to be my neighbor, and how close I could be to a visitor, and how close I could be to an unknown person, stranger who is coming to me to talk to me. So all these has been given back by Corona, and we have got a lot to learn from each other. Lot to learn from each other. And I must say, everybody should carry a paper and pencil all the time to find out who is doing the best and what is the best practice anybody is doing. We should try to practice that in our life. Every individual has to behave like a country. Every individual has to think that his mistake will affect the entire country. So that is how it should be. And every life is precious. Every number is precious. We always do not want to have a larger number of losses for us, and we also do not want large number of people to get infected by this virus. So we have very little idea about it. We have very little medicine about it. We do not have a vaccine. We do not know when it will come. But we definitely know this, that everybody has got a very good practice. The best practices of all the people should be noted down and it should be put into record. Like we will come back to history people after a year to ask you what actually has been helpful in fighting out this situation. So people like Joe, who are working in specified areas like this, and keeping a note of what country has done what, will be a very useful document and useful information for all. And before I say bye, I must tell all the participants, it's a very serious concern that you people, why don't you keep your microphones muted, all the participants. Only the
Please
moderator.
mute your.
That actually you cannot listen to anybody. I am not able to really listen to anything. So please enjoy this lecture, and it's a very one. I should not use the word enjoy. Learn from this lecture, and this is we are very happy that he has agreed to be in such a. I know this would not be a very comfortable time for him for this webinar. We are in different clock time now, so I think he will do his best, and we should get the best out of his lecture. Thank you, Joe, for agreeing to be with us, and we will definitely.
Yes.
So, thank you very much, sir, for these kind words. I'm reminded of the Vice Chancellor of York University. If you open the website, you'll find there's a wonderful, that is what our Vice Chancellor just said. The Vice Chancellor of York University, Charlie Jeffrey, says in his statement to his students in particular and the whole world in general, he says, let's watch together with a sense of care and compassion to fight COVID-19. This is precisely what our Honorable Vice Chancellor Professor Patra was trying to tell. So it is a collective effort. So all should come together. Let me also take this opportunity to tell all the participants who are not from Ravensa that Professor Patra is a renowned neuroscientist and is working on several aspects of neuroscience. And we are honored, and he has come from another webinar. So there's a very short time. We're very grateful to Professor Patra for being with us, because from his busy schedule, he has found some time to spare with us. So this encourages us like anything. And I must congratulate sir and seek his blessings for the department. With this, I now request Professor Nanda to formally introduce the guest and give the thematic address, introduce the theme of today's talk, and then we can go ahead with the
thank you, President.
Honorable speakers.
Thank you, President, and thank you, Professor Patra, for this.
May I request all participants please kindly mute their video audios so that we can clearly listen to the speakers.
Yes. I mean, very perceptive comments that came from Professor Patra, saying that, of course, Joe would elaborate on these aspects very strongly today, as I can see from the notes that he has shared with us about the talk that he is going to present. I mean, this aspect of listening to others is very important at this point of time, and as we encounter this moment, which we call as pandemic. I'm reminded of Amartya Sen, the famous Nobel laureate and also the economist, who was trying to look at a situation way back in the March when a number of people were walking down the streets of India, all the highways, what we call the migrant rivers. He said listening as a kind of governance, listening as a form of governance. He said that the time that state needs to listen to others. So it's not a question of listening to each other, but also the states need to listen to its own people, its own the multiple perceptions that is coming out of this crisis needs to be recorded, needs to be done. That is exactly Sanjay also reminded us how to write histories with a different narrative. So keeping aside these things, let me now quickly tell to the viewers that Joe needs no introduction. That he is a very eminent health historian, doing at least co-directing this center, WHS Sponsored Center at York University, which are basically trying to write global health histories. So he's part of that center as the co-director, and also by training he's a international politics expert. But look at his kind of academic orientation, and at the same time he's looking at a very interesting area, an interesting domain of exploring the nuances, the orientations, the dynamics, the challenges underlying this domain called health histories. Now, today this talk, which he labels as that what can we learn from Brazil, because one of the top countries of the globe today is Brazil in terms of having this seriousness of the crisis. So what kind of lessons that India could possibly learn from this? The insights for India would be to understand how Brazil responds to this crisis, and he is very much rooted in the whole process through which Brazil has developed its health system, and the processes that has gone into the making of a very robust health system in Brazil. So as we look always towards the European countries and also America, so also Brazil is almost like the kind of nation state and the other part of the globe, like India. So we have a lot of similarities in terms of economic dynamics. So that would be really interesting. What Joe is, as far as I can understand, what is Joe is going to argue today is that this crisis, this pandemic,
Namaskar, sir.
This pandemic is almost a man-made kind of thing. It has been this pandemic. When we look at this crisis, the health crisis, it's basically a kind of political one. Its essence can be understood in terms of political character. That is one. And secondly, it's not a public health crisis alone. It's not a kind of crisis of neoliberal economic order, but it's a neoliberal crisis itself. This is a crisis of neoliberalism. That is what is that point he's going to emphasize very strongly in this talk, that we need to understand this pandemic in terms of this neoliberal economic crisis, the crisis of neoliberalism as an economic model, and as such also as a neoliberal crisis. That is what I have understood from his idea that underlie or that underpin his talk. And the other aspect that he's going to also touch upon is that the growing vulnerabilities, the global vulnerabilities that has been accentuated by this neoliberal economic order. That is what he's also going to uncover, that this is how things have already been done. Look at 1980s, as we grew up from 1980s onwards to a very different moment of capitalism or neoliberalism, as we say this, or why we say that we are the generations which were born out after 1980s of a different generation altogether, and they have seen that they have been the part of that process of neoliberal economic order, and that economic order is of a different nature, where we have seen that in the preceding generation, the way health and education was emphasized, that emphasis was somewhat got delegitimized or de-emphasized, undermined. So public health was no more a public good, was not treated as a public good. Or for that matter, there is a lot of under-budgeting, underfunding. There is whole, one could see in 2008 also that because following this economic crisis that we talked in terms of following austerity measures, where we treated health as a kind of private good. So this idea of privatization, individualization, and a lot of competition, where market dynamics remains important, where state has minimal interventionist role in guiding the policy or the kind of priority which needs to be attached to health, was gone. So all these situations has led to a kind of crisis like this. So this is so health matters are deeply political, that the way he tries to gives out this call, that we need to understand that this pandemic has not been something like that it had to come or it was destined or something like that, but we have somehow been pushed ourselves into a situation like this to a large extent. But most importantly also towards the other thrust of his kind of argument that he's trying to also put up is that the fact that we need to see this moment in a different way. Like one is this neoliberal crisis, and the other aspect is this climate emergency. Then it is in the confluence of these two dynamics, the threat emanating from these two dynamics, that we need to redefine ourselves in terms of relations to ourselves, to a larger humanity, to the planet, to the globe. And that reminds me of the initial problematic through which we started discussing this series, with the idea that we'll talk in terms of the problems of Anthropocene and deepest ecology when it began or inaugurated of looking at these dimensions very seriously and critically as we look forward to writing the post-pandemic life world. So I think Joe's talk is going to give a different turn to the discussion today, because you have been listening to all these ideas apart from Niels Biemans, who partly talked about this kind of crisis. The other two talks were mostly geared around the issues of Anthropocene. Now Joe's talk tries to bring in together the problem of looking at climate and also the problem of the global capitalism. That makes, I'm sure that would really make this talk interesting, and we have many things to take away from his talk. Thank you, Joe, for agreeing to be with us, and I know that the way you have inspired for the making of this series, partly when I started discussing with you, and you were the first person who said yes. So your yes, then flowered into a number of yes subsequently, and that is how we are today. Thank you, Deo. It's a very great moment of satisfaction for me, for the department, for the university, and this bonding will continue to grow. Thank you.
Thank you, Professor Nanda, for giving a thematic note on the thing. Well, I'll add only one thing to this. Participants, please understand, Professor Joe is not only a professor in the Department of Politics, he is also the co-director of the Center for Global Health Histories, which is a WHO collaboration center. And apart from that, two of his latest publications, which I thought I will include, I'll just add to what Professor Nanda said. One of his latest book is entitled Security, Emancipation, and the Politics of Health, which is published recently. And one of his latest articles, co-authored with Gabriela Lota, is entitled Discretion, Power, and Reproduction of Inequality in Health Policy Implementation Practices. Discursive styles, and classifications of Brazil's community health workers. So you can understand from the kinds of thing he published, his focus on health history. So this will add a new dimension to our understanding of public health in a third world country like India. And more importantly, he is since Brazil and India are both part of an international collaborative entity called BRIC, Brazil, Russia, India, China, the Brazilian response and insight from Brazilian ways of dealing with COVID-19 will definitely enrich us. So we look forward to Professor Joe's talk today, and I welcome and I request now Professor Joe to deliver his address. Thank you so much, sir.
Thank you for all these kind words of introduction. I want to salute the Honorable Vice Chancellor of Ravenshaw University and all members of the staff of the History Department at Ravenshaw. And an honor to be invited to participate in this seminar series. And I also want to salute everyone who is joining us today for this seminar. I hope you'll find it interesting. What I want to do today is briefly, as briefly as possible, and broadly provide you with big canvas picture of the global aspects related with COVID-19 pandemic. And then I want to zoom in on the Brazilian response. And from the Brazilian response, I want to extract some reflections that I think may be relevant to other regional contexts, and particularly to the context of the Indian response. So I want to start with some remarks on global health governance, and this will lead me to think a little bit about what the world political context is for this pandemic and for the response. And then I will address the Brazilian case in more depth. So the first question I want to address here today is whether COVID-19 represented a failure of global health governance. And obviously, this is a difficult question to answer. Were we prepared, or could we be in any way prepared for a challenge of this nature? There are signs and there are some indications that there were indeed some insufficiencies in terms of the disease preparedness and the disease response. Okay, so we knew, or the scientific community knew about coronaviruses for a long time, and yet coronaviruses have been for a long time understudied in comparison with other diseases. One of the examples of how warned the scientific community was or should be is the case of SARS, the SARS outbreak in 2002-2004, which is now considered the bullet that flew past our heads. Just as it should have come as a warning. Coronavirus actually had the potential to present the challenges that SARS-CoV-19 is currently presenting. So there had been some warnings about this, and the world did not, I argue, pay sufficient attention in terms of understanding how these coronaviruses work. And this problem is particularly acute now because this coronavirus, which is a new coronavirus, presents its own challenges and presents its own uncertainties, which we are struggling to or racing against the clock to understand and make sense of. So there are all of these uncertainties, scientific uncertainties surrounding the new coronavirus, one of which, and perhaps one of the most important, is the question of asymptomatic transmission, which is arguably one of the biggest challenges that is facing scientists these days, and that is facing public health experts these days, is how to deal with the fact that a lot of transmission seems to occur in cases where there are no symptoms. Where there are no symptoms yet, and where even the disease does not assume nothing more than a mild form. So this creates a problem in terms of the public health response, not simply in terms of how to contain the virus in a situation of this nature, in which you cannot really say who is infected and how far and to what extent those who are infected are able to transmit the virus to other people. It also creates a problem which I think is relevant for international cooperation, which is a question of the reliability of notification numbers. Just to give you an example, the case where I've devoted most of my attention, which is the case of Brazil, which is a country that is among the countries that has the lowest percentage of testing per population. And the estimate in some regions is that the number of cases may be sub-notified by up to 700%. So there may be 7 times more cases than those that are officially notified. This includes, obviously, this sub-notification and also affects the number of reported deaths. So there are all of these uncertainties, which in turn create an issue of the reliability of numbers, which also hinder international cooperation in the area, and have opened the way for sometimes a political instrumentalization of the virus or of the pandemic. So with some countries, for example, accusing others of not disclosing the totality of their cases or of hiding data, etc. So this pandemic has raised an issue of international cooperation. It has also brought to stark relief the insufficiencies in certain public health systems. Arguably, no health system would ever be prepared for a pandemic of this nature. But the fact is that some health systems were remarkably fragile, remarkably unable to cope with the sudden influx of cases. And it should come as a surprise that nations that are prepared to spend millions and millions on areas such as, for example, military preparedness, were unable to have a response, a public health response that could deal with thousands or even in some cases hundreds of infected people. So there are these issues about the resilience and the strength of health systems that need to be raised. Now, this is so I would like to argue that there are indeed some reasons for us to think that there were some problems and there were some failings in terms of the emergency preparedness and response in this case. Now, what I want to go beyond the surface level and ask broader or deeper questions about the questions about the failings of global health governance in general. To put it another way, to what extent are our difficulties in dealing with COVID-19 connected with broader problems in global health governance, in its architecture, in its resourcing, the way it is designed, and the way it is implemented. Paradoxically, I want to argue that one of the problems that global health governance has faced in dealing with this health emergency is that, and this is the paradox of what I'm about to say, and happy to hear your thoughts, is that global health governance has become too fixated on emergencies. And as a result, it has become too reactive and not proactive enough in seeking to address the core causes and the underlying conditions that arise, that enable pandemics such as these to arise. So it has focused too much on the firefighting mode of response, so to speak, on responding and trying to contain emergencies as they come along, and has not given, I argue, sufficient attention, at least in a global cooperative way, has not given sufficient attention to addressing the underlying disease determinants, the underlying causes of these emergencies. So I want to argue that global health governance has become too reactive, too myopic, if you want to use that parlance, too short-termist, too focused on disease containment, on crisis management, without reflecting enough about the conditions that give rise to crisis in the first place. Okay? Not enough global level action has gone towards addressing disease determinants, be they economic determinants, social, cultural, infrastructural determinants of disease. So those conditions that give rise to disease. And not enough attention has gone to the underlying causes of these diseases, the underlying causes, and what makes the population susceptible or particularly vulnerable to these diseases. Not enough attention is given to what I would call the everyday emergencies, the situations that people are facing on their daily lives and that detrimentally impact upon their resilience, their ability to withstand disease and to react and rebuild and bounce back when disease occurs. So people are rendered vulnerable because of these everyday emergencies. What are the everyday emergencies? Poverty, lack, inefficient or insufficient access to sanitation infrastructure in certain regions of the world, insufficient access to safe water, insufficient or inadequate health information or health education, insufficient education in general. All of these, I argue, are everyday emergencies because there are problems that people are facing in their daily lives and that render them more vulnerable to diseases such as COVID-19, and that render them more unable or less able to bounce back from disease when it does occur. So, and I want to argue that global health governance does not pay enough attention to this, to these everyday emergencies, because it has, in my view, become too fixated on containing these major crises. Not enough attention is also given to an important issue that is bound to become even more important, which is the question of syndemics, the interaction between different epidemic episodes. In the case of Brazil, for example, you are witnessing a syndemic of different mosquito-borne diseases. These are dengue fever, Zika, chikungunya, and in some cases also yellow fever. And all of these syndemics, they create an epidemiological scenario that makes it extremely hard to respond. And the interactions between different diseases are not sufficiently studied, are not sufficiently understood. We are still beginning to understand how diseases interact with each other. Because global health governance very typically focuses on single diseases. COVID-19, SARS, malaria, polio, other diseases. We have not yet begun a systematic study of how these diseases, what's the syndemic scenario of these diseases. and how they connect with what's been termed now, and Professor Nanda spoke about this issue, the question of the Anthropocene. To what extent are this endemic scenario also interacting with other non-human species and the environmental scenario? We don't know enough about our ecosystem in terms of how it may affect our health, and how changes in the ecosystem that are being introduced by human activity, with the question of the Anthropocene, will impact human health in the future. We're still discovering, we're still studying that, and we need to know more about that. So global health governance has failed also, is failing also, because it is not seeing health as truly planetary. It's not adopting a planetary scale for understanding health, a planetary canvas, because we need to understand human health not simply as that what happens inside bodies, human bodies, but also that which impacts all other non-human species and the ecosystem as a whole. And this was brought into stark relief by COVID-19 because it is a zoonotic disease. So it is a disease that comes from animals. But also, mosquito-borne diseases have animal vectors. So understanding the interactions between humans and non-human species and how human activity is introducing changes that are so far unpredictable is essential. It's essential that we come to terms with the full implications of what human activity is doing to the planet, and how this is endangering health, and how this is endangering very human survival. And global health governance must become a governance of planetary health, and not simply a governance of human health. Okay? So we need to go beyond this narrow view of disease as something that of health as an absence of disease, which is still very much present in our response to the COVID-19 pandemic. We are, understandably, we are desperate for a vaccine. And in a way, vaccine will address and will come to solve many of the issues that we are facing. Will enable people to get out of social distancing, will enable people to get back to work, will enable economies to resume working at a normal level. But vaccines are not going to be enough to address this issue of planetary health, which is a broader problem that we need, that requires more than vaccines, requires a rethinking of our political and economic arrangements. And this leads me to turn to the question of political economy, which Professor Nanda already hinted at in his presentation. I think COVID-19 is a larger problem of the international political economy, is a problem also of neoliberalism. Not because neoliberalism has caused it, the disease itself, that would be ridiculous, but neoliberalism has created the broader problem in which COVID-19, or the broader context, the broader scenario in which COVID-19 is now circulating. And the reason, I suggest, the reason why COVID-19 is having such a devastating impact, not just in terms of human lives, of human health, but also in terms of its social and economic consequences, is because of the process of vulnerabilization that has accompanied the rise of neoliberalism. Let me explain that in more detail. My argument is that we live, I think this is undisputed, in a global capitalist economy, and this global capitalist economy is based on a system. It's a system that is predicated on incessant economic growth, consumption, and waste. Specifically, we are living in a neoliberal era of global capitalism. The neoliberal political economy is based on deregulation, is based on privatization, the marketization of health and other public services, the hollowing out of the state as a service provider, and the hollowing out of health as a public and collective good. For me, this creates a situation of vulnerabilization. We have become unprepared through the impact of neoliberalism. We have become unprepared to deal with health pandemics of this nature. This is because our health systems have been rendered more fragile by neoliberalism, by the dismantling of the state as public service provider, by deregulation, by marketization and commodification of health. Working conditions have become more difficult, and work has become more precarious in general. This applies not simply to the health workers who are on the front lines and who are suffering the greater risks in fighting this pandemic, while living highly vulnerable lives in many cases, for example, in Brazil, and while living in precarious working conditions. And neoliberalism has also entailed the absence of social safety nets, which has meant the destruction of the livelihoods of many people who need to stay at home, or whose livelihoods have been affected by the economic consequences of COVID-19. So what we see here is that neoliberalism is conditioning not just exposure to disease. The people are vulnerable to becoming ill, but also people are unable to cope with disease, to be resilient when disease occurs. Okay, so I think we are witnessing here a situation of a global vulnerabilization, which is brought about in part. I don't want to say that it's just about capitalism. We could argue that there are other important dynamics in place, such as, for example, the dynamics of environmental destruction, the dynamics of colonialism and neocolonialism, dynamics of racism, patriarchy, etc. There are different destructive dynamics, but in part, this is brought about by global capitalism. At the same time, at the moment when we would need most a cooperative, a solidarity at the global stage, we are witnessing, and we have been witnessing in the past few years, a retreat of multilateralism and a crisis of cooperation, international cooperation, international solidarity. This is visible in the way in which many governments in the North Atlantic area, or the Atlantic area, namely the United States, even partly in the UK, also in Brazil, how these have been predicated on so-called criticism of what they call globalism. To translate, a criticism of multilateral institutions. The USA has criticized and now announced that it would be leaving the WHO in the midst of one of the largest pandemics that the world has seen in the past decades. Brazil is another example of a country that has been very vocal in its criticisms of the WHO. In general, what we're witnessing is a retreat, a nativist retreat of multilateralism, and the rise of far-right populisms that are predicated exactly on this rejection of cooperative and solidaristic responses at the international level. This is, I think, a serious problem that is preventing us from having actually a more effective response. At the same time, we see the throes of the rise of xenophobia, the rise of racism, the throes of a patriarchal and misogynistic order, and I think this makes a toxic and deadly cocktail of circumstances that condition our response to COVID-19. Okay, so having given you a broader picture of where we are now, I think in terms of global health governance and world politics, I want to zoom in on the Brazilian response. So you may have read the news that Brazil is now considered one of the worst examples of how to deal with COVID-19. Data as of this morning, the country was second in number of cases and second in number of deaths. Only falling behind the United States. We're talking about close to 2 million notified cases, but note the issue of subnotification I talked about previously, and it was close to 75,000 confirmed deaths. But again, the number will certainly be far higher. In order to understand how Brazil has failed, it's important to first give you a background of what the context of the Brazilian epidemiological profile and its health system is. The country has a very challenging epidemiological profile, one which combines diseases of so-called developing nations, for example, mosquito-borne diseases, parasitic infections, neglected tropical diseases, etc., but also has at the same time problems so-called of affluent nations, for example, cardiovascular disease, chronic disease, cancer, etc. In a way, I think in that sense is similar profile to that of India. At the same time, like India, Brazil is an immense country with a huge diversity, huge heterogeneity in terms of its story, background, in terms of the needs of the specific needs of populations in different territories. So there are some similarities here in terms of the heterogeneity of the country. In terms of the health system, Brazil has a public health system which is free at the point of care, paid by taxes, federal level taxes. It's a system that is coordinated or supposedly coordinated at the federal level. Brazil is a federal country, like India. It's coordinated at federal level, but it's also highly decentralized. So it's a system that's been designed also to ensure flexibility to respond to this heterogeneity on the ground. An important issue that needs to be presented first and foremost is the problem of the chronic underfunding and the under-resourcing of this system. The Brazilian public health system has faced for many years problems with lack of funds, lack of trained professionals, health professionals, doctors, to respond to the sheer magnitude of the population and of the territory. So there are all of these challenges, and the system is under-resourced and has faced in recent years the onslaught of a privatization wave. So a consistent strategic effort on the part of certain sectors of the population, certain sectors of industry, and also some politicians to dismantle the system or to gradually erode the system with a view of opening the way to private health plans. And Brazil is already one of the countries, certainly in Latin America and in the American continent, one of the highest countries where there's the highest percentage of private health plans, one of the highest countries where there is private expenditure in health, far higher than what you see in any European country. But this is a process that the system is consistently under attack by this privatizing effort. So what has happened in the political response to COVID-19? And I want to argue that partly the reasons for the failings of Brazil in respond to the pandemic have been at the political level. Brazil has some of the best scientists in the world, some of the best health workers in the world. They're conducting cutting-edge research on many areas of research, for example, in tropical diseases. They are an example to the world in terms of the quality of their research, the quality of the organization of the health system. That said, the failings have been at the political level. What has happened? And here, the buck stops, and I want to lay the blame first and foremost on the failings of Brazil's president, Jair Bolsonaro, who has reacted to the crisis basically going through a checklist of all the errors that could be committed. This political response has been a mixture of denialism, a mixture of political instrumentalization or instrumentalization of the disease for political purposes, for politicking, for attacking his opponents, attacking the WHO. There's also a lot of incompetence and a lack of leadership, lack of clear leadership at the federal level. This has been one of the major issues here. And I want to connect this, for example, one clear example of this. Some of you may know, Brazil has had 2 health ministers leave their post during this pandemic. 2 health ministers have left in disagreement with the president during the pandemic. Brazil is now without a health minister for around 50 days. There is an interim health minister who has been recruited from the military, but there has been no appointment of a health minister for 50 days. This translates in lack of leadership, lack of political coordination of the response effort. The pandemic has been involved in political squabbles, ongoing wars between the supporters of the president and his detractors. The president has also contributed to discrediting scientific knowledge, discrediting and going against the advice of the health authorities. For example, he repeatedly left his palace to socialize with his supporters outside without wearing masks, against the advice of his health authorities. The president has peddled unproven therapies, such as, for example, hydroxychloroquine. And so there's a number of issues with the way in which the government, particularly the president and his close circle, have responded and have, in a way, kind of led to a systemic failing of the system because of lack of coordination. What does this happen on the ground? On the front lines, which is the area which I've been looking at, community-based responses, the situation you observe currently in Brazil is one of chaos. And that's the best word to describe what's happening. Me and some collaborators have been in touch with representatives of the community health workers, which in a way, the equivalent in India would be the ASHA, the Credit Social Health Activists. So the community health workers in Brazil, we've been in touch with some of their representatives, and the situation that they described is of disarray. There's no guidance, no coherent, concrete guidance about how to respond to the pandemic, about the role of these community health workers in the response. There has been no training about how to deal specifically with people who are infected, how to avoid becoming infected. So these workers have needed to resort to their own means or to their own local teams to get some sort of training, because the federal government is not providing coordinated, uniform training. According to a survey that some of my colleagues, namely Gabriela Lotta and others, have carried out, only 9% of community health workers had received personal protective equipment. So this means the overwhelming majority of these health workers did not receive PPE, personal protective equipment, from their governments, had to buy it themselves, or had to do makeshift equipment. Mind you, a reminder that having personal protective equipment for these community health workers is absolutely crucial, because as you know from the ASHA workers in India, these are workers that are in close contact with the communities. They come from the communities, and their work is predominantly based on close interaction with the health system users. So they need personal protective equipment. Without this personal protective equipment, they are at risk of becoming infected, or they are at risk of becoming vectors for the disease, of spreading the disease to their community, spreading the disease to their families and their close ones. So it's absolutely crucial that there are that the equipment that the equipment is provided. And what we observed is that it is not in Brazil. It's not being provided. There is some resilience of the health system at the municipal level, at the community level. But that said, in the absence of a federal level coordination, there's only so much that community level responses can achieve. Ultimately, the Brazilian response to COVID-19 is being undermined by failings at the federal level. And despite the resistance, despite the capacity of community level workers to adapt and in some cases improvise in a context of insufficient resources, insufficient training, and lack of coordination, ultimately the response is ill-fated because there is no coordination, there is no clear message coming from the government, and no clear show of support coming from the government. So this is a picture of what's happening in Brazil. I'm happy to field some questions about the specifics of the Brazil case. Let me just move on, because I'm conscious of time. Let me just move on very quickly to what can we learn from the Brazilian case. I think there's a number of challenges here, but there's some things that I can already say. First, populism does not seem to work in response to in the case of epidemic responses. This is because populist leaders are by nature insecure. They see every problem, every challenge as a test on their popularity, and they make their calculations on the basis of what will increase their popularity in the short term. They tend to embed epidemic episodes such as this one in context of political squabbles for political short-term gain. Populism does not work. And the way in which in Brazil, what you've observed is a president that was at war with his health minister, at war with the health authorities, at war with scientists and experts, shows the extent to which populist leaders are a liability. There may be a liability in other things. I don't want to go into that. But in terms of the epidemic response, they are certainly a liability. And this is what happened. I don't want to go there, but we can talk about that as well. Arguably what's happened in the case of the United States as well. There is also, this is the second reflection, there's also the need to establish and maintain, there's a difficult balance between, on the one hand, the need to have a centralized response. There needs to be a clear message coming from all levels of government, ensure capillarity, ensure flexibility so that health workers can respond and can adapt to the particular challenges on the ground. What's happened in Brazil was that the federal level at some point was saying the economy needs to continue working as normal. The country must not stop. And state governors were saying we need to introduce social distancing. People need to stay home. And this is mixed messages that impaired the effectiveness of any social distancing policy. The question of masks, at some point, the state governors and local level authorities were saying you need to use a mask, you need to wear a mask when you go to the streets. And the president was fighting these things in courts, saying that people should not be forced to wear masks. So there's mixed messages here coming at government, and this is the worst that could happen in a pandemic. Lose all trust in politicians. They lose all trust in health authorities. There's also the issue of scientific expertise. This is the third reflection that I want to offer here. One of the issues with COVID-19 is that the scientific advice was constantly being updated as research went on. Okay, because research was finding out new things about asymptomatic transmission, about use of masks, etc., herd immunity, all of that. So the scientific knowledge was being updated constantly. And this resulted in sometimes the directives from health authorities were being updated. Now, it's important to maintain the credibility of health authorities and make people believe and establish relations of trust with the health authorities, while at the same time managing expectations so that people accept that science is something that is fallible. Science is something that progresses, and that scientific knowledge is updated or can be updated. And sometimes advice may change given the circumstances of what's the state, what's the state of the art in terms of the scientific knowledge. And this was an issue because in Brazil, at some point, scientific advice was questioned, not just by the president, but by the population who got confused messages. And a similar issue, for example, is happening with another populist leader, Trump, who is constantly attacking and undermining his health authorities. So this is another issue. So this raises the issue of communication. Communication and filtering under control, I wouldn't say the way in which we manage expectations of the population, it's absolutely central. And the way in which health authorities are able to move swiftly to disprove any false information or misinformation that's being circulated, sometimes with political purposes. I think finally, another issue I think that needs to be raised is how to maintain the regular activities of the health system. COVID-19 is not the only issue that we're dealing. There are other issues that have been put on the backstop that have not been receiving sufficient attention, while the eyes and the attention of the world are turned to COVID-19. So how to maintain the regular functioning of the health system in the state in which there are these emergencies that are demanding so much from the health system. At the same time, and this particularly applies to the question of primary health care and health promotion. I've talked to you about the issues of community health workers, whose main work is to carry out activities of primary health care, of health promotion, health education, similar to what's happening with the ASHA workers in India. Now, when the work of these community workers is dependent upon social interaction, what can be done in a situation as with COVID-19, where the very interactive nature of this activity is the risk, or is at the heart of the problem? When community health workers cannot do house visits, when they cannot go into the communities because proximity, social proximity is part of the problem, how to carry out health promotion and health education and primary health care in these conditions. This is, I think, one of the biggest challenges for the post-pandemic era. How to reconceive primary health care in a situation in which interactive work, community level, face-to-face work has been problematized. The answer may be in part through the use of tools such as digital health or telemedicine or whatever, but it cannot be simply about that. This is because we need to temper our euphoria about telemedicine and digital health, etc., with the reality of inequality and exclusion. Many people need the face-to-face interaction. Many people are excluded from the digital economy. They are excluded from the ability to use telemedicine for many reasons, economic, territorial, etc. So we still need the ASHA workers. We need community health workers. We need doctors who go to the peripheries, who go to the more remote areas of the territories. We need a medicine and healthcare who's based on proximity. Now the challenge is, how do we deal with this issue of proximity, which is an absolute requirement for addressing these inequalities and these forms of exclusion that persist? How do we do that in a situation in which proximity has been questioned as a risk? And I think I'll leave it at that. And time is running out, but I'm happy to answer any questions.
Yeah.
Thank you, Joe. It has been a great stimulating lecture, and you painted a very grim scenario in Brazil, where it is the second highest in number of infected cases and second highest in terms of death toll. And there has been around more than 75,000.
It has been a wonderful lecture. I loved it.
Thank you so much, sir.
Very well said, everything. And we now have to learn a lot from you.
Yeah, Priyadarshi, can I just intervene?
Yeah, please, sir.
Uma is waiting with some of the quick takes from the
fine.
Audience. So let him come and join us. Hello, Uma.
Could I just say one thing? I have around 10 minutes because I'm due to go to another session. But if not, I'm happy to answer any questions via other means. Or if you want to send me the questions, I'll be happy to address them.
We are going to share all the questions to the panelists.
Thank you.
Dr. Umakant Mishra, would you please take up 3-4 major questions, and then we'll end up.
Very quickly.
Good evening, sir. Namaskar. Thank you, Professor Joe, for the wonderful lecture. And I can sum up your lecture in 3-4 sentences. You talked about locating the pandemic in. I believe I am audible to you and to all. You located pandemic to the larger context of political economy and inefficient populist politics. Populist politics and neoliberal political economy, out of which also this populist politics also emerged at some point, especially after 2008, financial crisis. You also talked about many of the lessons that emanate from Brazil, having so much similarities with India. There are obviously many lessons that we need to learn, but the major focus has been the synchrony between scientific communications and political communications. And, with Fauci on the one hand and Trump on the other in the same frame, and giving two different kind of communications and the way things have been bungled in both America and Brazil. So therefore, and also about how to maintain a regular health system at the time of pandemic, which is very important. There are certain questions, and these questions are very general. One question that came from Dr. Anthony, why did WHO fail in preparing nation against this pandemic? I hope Joe is listening to me. Why WHO failed in preparing nation against this pandemic? And you have addressed this issue while trying to explain that intergovernmental cooperations and multiculturalism is one of the victims of neoliberal economic order, but you can address this issue why WHO being underfunded.
Any other questions?
Second issue, yes, sir.
Any other
second issue, should this virus be called a neoliberal virus? There is a question from Pujarani Panda who says that should not this virus be called a neoliberal virus? Then there is a question from Rajat Khan Das, is economically weaker section of society more resilient than the rich in fighting pandemic? Even though they are more vulnerable, they are more resilient. Thank you so much. I hope I am audible and you will address
Yeah,
these questions because you have also limited time now.
yeah, please.
Mm.
Joe, please.
Okay. Yeah. Okay. Whether the WHO has failed, it's a very interesting, very important question. I'm very wary of and very conscious of the WHO being seen very often as a low-hanging fruit for all accusations whenever global health governance fails. Certainly, there have been some things that the WHO could have done differently, and I can speak a little bit about that. But first, let me, I think it needs to be a broader background. The WHO is a key element of the global health governance architecture. Its main functions are connected with the provision of technical expertise to countries and the fostering and facilitating international cooperation. That said, the WHO is not the single, and it's arguably, in terms of resources, is not the most important actor in global health governance. So you have other actors who are arguably more powerful than the WHO. I'm speaking, for example, of institutions, international institutions, such as the International Monetary Fund, or the World Bank, or philanthropic organizations that, like the Bill and Melinda Gates Foundation, who has a bigger budget than the WHO. Okay? The Bill and Melinda Gates Foundation has a bigger budget than the WHO, and yet people are attacking the WHO as if the WHO was some sort of world government of health, which is not. Okay, so the WHO is an important player and may have some part in the responsibilities of what happened, but there's limits to what the WHO can do. The WHO receives its money from nation states. And increasingly, what we're witnessing is that this money comes earmarked, which means that the WHO does not have autonomy to use its own money. So the WHO receives funds from, say, country X or country Y. This money says, you need to spend this money on this, this, or that. So the WHO needs to spend the money on the priorities and the agendas of its donors. Now, this is a problem for a technical body like the WHO, when it cannot follow what would be the most technical or the most scientifically sound process, and needs to follow political agendas of its member states. That said, there seems to have been a problem here in terms of how the WHO was able to respond quickly in terms of what the initial phases of the pandemic. Particularly in terms of what certain countries that were at the beginning of the outbreak were, particularly China, were offering in terms of information or not. I don't know enough about this, how open or closed certain countries like China, but other countries have been in terms of providing information. What I argue is that the system, the system of the WHO, its legal architecture, did not function nimbly enough, swiftly enough, to be able to collect the data that was required to really get a picture of what was happening. That said, the reason why the United States is the number one in terms of infections and cases is not because of the WHO, it's because of the United States leadership. The reason why Brazil is number two is not because of WHO, it's because of Brazilian leadership and Brazilian incompetence. And arguably what's happened in Europe and other cases, in other situations, is also because of that. It's because of failed policies at national level. The reason why the United Kingdom was so impacted was because of an erroneous approach at the start of the pandemic. The UK reacted slowly and using the wrong strategy. And this is why the UK was so affected. So all of these reasons arguably WHO may have had some degree of responsibility, but the brunt of the responsibility lies squarely, in my view, on the failings of national governments. In terms of whether we can consider this a neoliberal virus, well, yeah, I mean, if you want to stretch that metaphor, yeah, I think it cannot be separated from our context of neoliberalism. What we witnessed here was, sorry, go on, yeah.
Aptly referred to this epidemiological neoliberalism, somewhat akin to this idea of neoliberal virus, that what he's talking. I mean, that catches the point.
Yeah. So the point of epidemiological neoliberalism is this view, is this vision, and this was put forward by an author, can't remember now the name, Fry, I think, who argued that
there's a technical problem, it seems. Professor Joe, can you hear us? You're not audible.
Manish.
Professor Joe, can you?
No.
Yes. Can you hear us? No.
The connection is lost.
Okay.
Professor Joe, can you? I think he's trying to connect. Professor Joe, you are disconnected somehow. We are now unable to hear you.
I believe the connection is lost. You can close it now.
Yeah, Manish is working on it. Just hold on for a minute.
A new semantic emerge, which is syndemics.
Syndemics. Yeah.
I think he very beautifully summarized how the syndemic has to.
Okay, it looks is disconnected, so you can close it down now.
Sir. Okay. Professor Joe was saying that he's only having 10 minutes to go for another webinar. So I take this opportunity to immensely thank Professor Joe Nunes because of a very stimulating, very enlightening, and very powerfully packaged talk on very practical solutions for India. And yes, that populism will not work, that the federal failure has to be taken care of, that political mileage cannot be taken precedence over health governance priorities, and then we need to talk about, we need to have a coordinated, centralized efforts, and we need to protect and encourage and guide and provide proper direction to our health workers working on the ground. Then we need to maintain a balance between the COVID disease and its impact, and also between non-COVID epidemics, which are equally very problematic in countries like India, Brazil, which are huge countries with a lot of diversities, a lot of heterogeneities, and we need to give proper guidance to our people, and we need to really balance between economic.
Yeah.
Am I audible, sir?
Priyadarshi is not audible really.
Sir, am I audible now, sir? Hello? Am I audible, sir? Professor Nandu,
yes,
am I audible?
Yes, very much. Go ahead. But Professor Patra cannot hear you. Just, I think it's a slight disruption somewhere here and there. Just go on. It's very clear to me. as
Okay.
such.
So I was just trying to say that we need to rethink about political and economic priorities and need to really redefine our health governance mechanisms. And I think India is doing what I got from Joe's lecture was, I think India is doing, this should be a passing judgment, but I think India is doing far better than Brazil in terms of responding to, in terms of coordination between the center and the states and the regional and the local units, in terms of even
Yeah, now Joe has come back. Joe has come back. So let me
welcome,
Sorry,
Professor Joe.
I'm
Yes,
terribly sorry. I had a problem with my
please
internet
go ahead. Please,
connection.
you can
No,
conclude this.
well, thank you. I just wanted to just finalize by saying that I think in terms of the position of neoliberalism, very quickly, obviously we still have some time to go, and there's still a bit too early to see what exactly are the historical lessons that we can take from this. But I think at this stage we can already claim, and I want to claim that the reason why this pandemic has hit countries so hard, and the reason why so many people have been affected, and the reason why so many people have been thrown into a life of unemployment and destitution and economic vulnerability is because of the process of vulnerabilization that has occurred in the past few years under the guise of neoliberalism. And again, I'm terribly sorry, but I need to move on to another commitment. But I just wanted to once again thank you to everyone, to the wonderful audience and the questions that have popped up on the screen. And also thank you again, Professor Chandy, for this invitation. Honorable Vice Chancellor, thank you for attending this session, and all of the moderators and all of the staff at the Department of History. And I hope to continue our conversations, and I'm available to continue collaborating with Ravenshaw University in the future.
Thank you.
Thank you so much, Professor Joe. It was really a stimulating and enriching lecture. I would just
get back to you. I mean, the final comment from Professor Patra is we need to have some final. So if you have some work, you can just go ahead. You can.
Sir will say something. Professor, Vice Chancellor, sir will say something. Sir, please go ahead.
Okay.
Sir, are you audible?
Sir, can you hear us?
I can hear you,
Sir,
but I cannot hear Priyadarshi.
Sir, we can hear, sir. Please go ahead. Go ahead with the comment, sir. We can hear you, sir. Sir, we can hear you and see you. We can go ahead with the comments, sir.
I think.
Okay. Thank you.
Sir, can you hear me?
Just wait. Sir, can you hear me?
Yeah, I can listen you, but I'm not able to listen Priyadarshi.
No, forget about that. But if you want to say something, please go ahead, sir.
No, I thoroughly enjoyed this lecture, and there are so many things that India has to learn from this Brazilian thing. And of course, the Indian government did much better than that. But at the same time, Indian people of India have to learn from this a lot from this. And particularly, I want to say one thing. I wanted to say to Joe also that India should now. He nicely said about syndemics. India should now get for this situation also, because with the monsoon coming in, we are likely to have many more things which can be happen with this virus itself. So this is something, the comorbidity and the situation of having other infections alongside this, opportunistic diseases particularly, one has to be very careful about it, and the country should now get ready for this. Is the most important learning we must get from his lecture. That we also have dengue, we also have all those kind of malaria. We should not forget. We have got everything, and now the point is that with the monsoon in, the insect population going up, the vectors going up, now we have to be very, very careful, and the entire Indian population has to be careful about it. And we must learn from what went wrong in Brazil, and we should not be doing that. This is a very interesting and very important lecture we had. Thank you very much, Chandy, for getting all these people together and lining up a very good webinar. But I'm also not very happy about it that most of the students are missing it. They should be there. I welcome the students to come and join. These are the ways which makes you excited to really one day become a professor like Joe and speak to the world. I'm very happy today. Thank you. Thank you very much. Bye-bye.
Yeah, just a quick comments from my side that I want to remind the viewers that tomorrow we are having this talk sharp at Indian Standard Time, 4 o'clock, 4 to 6. There is an anthropologist who is speaking to us tomorrow.